Do you or a loved one have heart problems? Wouldn't you like access to best-in-class technology to track your heart's health after a major heart event? Welcome to Gramercy Cardiac, led by world-renowned cardiologist Dr. K. Peter Rentrop. Dr. Rentrop is a pioneer and expert in diagnosing coronary artery disease with greater precision, utilizing the latest technology in heart health, nuclear PET scans.
The PET scan is used for assessing blood flow to the different parts of the heart at rest and during stress. Limitation of blood flow caused by blockages in the coronary arteries is the most powerful predictor of sudden death and heart attacks.
Gramercy Cardiac is one of the few private practices in the country with its own nuclear PET scan, offering access to world-class care like never before.
Both the SPECT and the PET scan assess blood flow to the heart. SPECT allows us to assess the relative distribution of blood flow in the different part of the heart. The superior PET technology enables direct measurements of absolute blood flow to the different parts of the heart.
Getting a PET scan is a safe and simple process.
After my heart attack, I felt that I wanted to see the results of the quadruple bypass, and I felt that doing some research, the PET scan was the best way to evaluate if there are any other issues that I need to be concerned about moving forward.
After checking basic vitals, the nurse will prepare an IV. Once completed, patients will be escorted into the PET scan room.
Several studies have shown that if patients are initially evaluated with a PET scan instead of a SPECT scan for coronary artery disease, the likelihood that they will end up getting a coronary angiogram and bypass surgery or stent is cut in half. The PET scanner, the machine which is used to perform the test, is different from an MRI machine. It's much more open. It does not cut off the view, and it is also not associated with the banging noises that you have in an MRI machine.
There, a qualified nuclear technician will inject a radioisotope tracer which has no side effects. Patients then enter the PET scan machine and can relax and breathe normally. Halfway through the scan, the technician will re-enter to administer a pharmacological cardiac stress to increase the blood flow to the heart.
A medication is infused into an arm vein of the patient, which dilates the blood vessels of the heart maximally. This results in maximal blood flow to the heart muscle, and we can see whether that maximal blood flow is limited by any blockages in the coronary arteries. The severity of this limitation corresponds to the severity of blockages in the patient's coronary arteries.
I think raising the level of awareness of where your heart health is at the moment is the important factor here.
PET scans can be used for many different applications, including post-surgical scan to see if a bypass or stent is working, pre-surgical scan to determine the extent of heart blockage, determining the need for a coronary angiogram, determining the need for a coronary stent or bypass surgery, determining whether your heart can handle physical activity, and can provide a post-heart attack or heart trauma snapshot.
The greater precision of PET results in avoidance of unnecessary procedures such as cardiac catheterizations, stenting, and bypass surgery in patients who don't need it.
After 25 minutes, the scan is complete and the patient is taken out of the room by the attending nurse.
If you combine the initial greater cost of PET with the savings downstream by avoiding surgery and other things in patients who don't need it, you actually save money, which is the main reason why Medicare has approved PET early on.
After the scan is complete, you may review your results with Dr. Rentrop or have them sent to your doctor.
I've had 2 heart attacks, and if I had had this PET scan done several years ago, I would have been able to realize how I could possibly change my lifestyle and maybe prevent further heart damage. So I feel that it was a very important test for me to go through.
If you or a loved one has been diagnosed with coronary artery disease, our office will work with you, your doctor, and insurance provider to identify the next best course of action. Additionally, if you haven't shown symptoms or indications of heart problems, but have high stress levels, high cholesterol, or a family history of heart disease, our cash payment options allow all patients to access the gold standard of technology for heart screening.
The PET scan allows us to predict the risk of heart attack and sudden death with greater accuracy than any other test, and that is why it's the gold standard.